Jamaicans at home and abroad, good morning again to you all. We are going to be getting some updates very soon. Since our last presser, which we had yesterday, a lot of things have changed. You'd have seen the updates this morning where we were upgraded to a tropical storm warning and a hurricane watch. You would have also seen a notice that out of an abundance of caution, we did move our classes and our schools to the remote environment. And so those are two key updates so far. The agencies of government have been working, and you will hear all about that this morning. The Met Service, usually we start with them, but they had an important meeting with the National Hurricane Center, so we're going to change the order. Usually we start with the forecast, but this morning we're going to be starting with Minister Tufton, who is going to give us an update from the Ministry of Health standpoint. They're very, very important in the preparedness and also in the response mechanism of government. And so we'll have Minister Tufton first. So first up is Minister Tufton. Good morning, Minister.
Thank you very much. Thank you, Minister. And let me just welcome and recognize my colleague ministers in the audience who have been mentioned before, members of the civil service group, including my own permanent secretary, Errol Green. And I also have with us our head of the emergency services in health, Dr. Dawkins Wright, who is prepared to elaborate on any specifics related to our preparedness. So I'll give you an update on our plans and what the possible impact of the storm is likely to have on the health services. So we do anticipate, even though we hope not, that given what is being projected, that there will be some disruption in our health services, interruption of supply chains, including for medications, the possibility of injuries from wind damage, debris, and falling trees, the risk of waterborne or vector-borne diseases from flooding and stagnant water, challenges to our most vulnerable, among them people living with chronic diseases, the elderly, persons with disabilities, pregnant women, and children. So there's likely to be an impact on the entire society, or entire lives, and we need to prepare for that. The Emergency Operation Center is now fully activated within the Ministry of Health and Wellness. It's a 24-hour center which keeps in touch with all the collaborating agencies and mans from that space the response that is required throughout the country. And that is up and running. We continue to prepare our efforts across the island, and we have had a number of consultations over the past number of days with the regional health authorities and other stakeholders. So these are some of the specifics. All public hospitals will now enter emergency mode. This means that while hospitals remain open, outpatient services and elective surgeries will be suspended for the time being to focus on the emergencies. Visitations will be limited, and family members are asked to pick up their relatives who have been admitted for non-critical reasons, and the respective hospitals will reach out to those family members. We have to reserve bed space just in case we need them for emergencies. In terms of health centers, we remain open until 4 p.m. today. A further update on our health centers will be provided tomorrow. So up to 4 p.m. you can access health centers across the country. We have 325 across the country. In terms of the system readiness, there are approximately 116 priority facilities, 25 hospitals, and 91 type 3 to 5 health centers A verification exercise has been conducted with key capacity indicators, which include the following: human resources, some 702 personnel identified and are on standby across parishes for emergency response activation. All assessed facilities have documented staff welfare measures in place, so we have personnel in place. Secondly, command and control, 100% of priority facilities have established identifiable command centers to coordinate emergency response operations with clearly defined roles and responsibilities. Backup power systems, 75% of priority facilities have functional backup electricity systems, generators with fuel reserves, capable of sustaining power for some 72 hours post-disaster. And the generator project has equipped some 21 primary care facilities, increasing the total to 60 facilities across the country. This is for primary care, the health centers. Medical gas and supplies, 100% of priority facilities have sufficient medical gas supplies, estimated to last some 72 hours. Strategic stockpiles of medications and medical consumables have been verified and are maintained at a minimum 72-hour level. Infection prevention and control, 100% of priority facilities have been documented infection prevention and control protocols and system visibly in place. Transportation fleet, 87% of priority facilities reported having fully functional transportation or vehicles fleet for emergency response and patient support. Communication capacity, 75 UHF radio systems available for mobile response teams. Based on radio check, JICA emergency communication project is in operation in some areas as of July 2025. Starlink backup communication system have been tested in Western region for enhanced redundancy. So we are putting in and have put in communication systems to be able to communicate if there are disruptions in normal channels. Surge capacity, hospital inpatient capacity of approximately 5,000 beds, 20 operating theater units, 19 emergency rooms across the public system. And there are plans for the rapid redeployment of mobile response teams if required. And there's one functioning field hospital, which is currently being deployed at the Maypen Hospital. Multi-sectoral coordination, parish, hospital, and National Health Disaster Committee meetings have been convened. The Water, Sanitation, and Hygiene Coordination Committee has been established and engaged with partner agencies, including agencies that are here, the NWC, UNICEF, Food for the Poor, JDF, and the NWA. I want to just use the opportunity, having given these specifics, to encourage Jamaicans to work with us to ensure their safety and good health during this period. Ensure that you have at least 72 hours of essentials in a storm-ready kit, somewhere that it can keep dry, okay? And storm-ready kit is sophisticated sounding, but it could be a plastic bag. Ensure that you include in this non-perishable food. Spoiled food can be a source of serious health concerns if you have no light and your refrigerator goes down. So the tin stuff, right? And other non-perishable foods. Water is essential because waterborne diseases tends to be the logical consequence after a storm. Medications, flashlights, battery-powered radio, and extra batteries. So it's important that the public take the next number of hours to prepare themselves. If you have chronic illnesses like diabetes, hypertension, kidney disease, respiratory ailments, ensure that you have your medicines and know how to take them if services are disrupted. And we do encourage persons to communicate with their health provider in anticipation of the possibility of disruption. So whatever clarity they need, they can get before. We also would like to say and encourage you to stay tuned to updates, and I'm sure there may be the Met Service and ODPM and so on that will give updates, but the Ministry of Health will also provide updates as necessary. and the extent to which you can get those updates from main media, traditional media, or otherwise, you should. However, my closing remark is that be also cautious around the social media communication and ensure that it comes from sources that are credible.